Good morning, everyone. Can you hear me in the back? Or you? Yeah. Okay. Great. So yes, just gotta introduce myself. So that's me. I work at Rutherford, like she mentioned, and I also have clinic in Sparta and Shelbyville, where I go every other week to see patients there. So, just for information. So I have special interest in coronary artery disease and valvular heart disease, and I see patients in the hospital, so I take care of acute conditions for the patients also, and chronically, obviously, in the clinic. So, both ways. And just more about myself, I enjoy going outdoors, like going hiking, playing soccer, and doing outdoorsy activities. So that's my thing. I'm originally from Nepal. I don't know if you've been there, but yeah, I moved here like about 7 years ago. So it's been a while. Okay, so I don't know if you know, but this is the American Heart Month. February is where a lot of activities are done for heart health. So I think it's a great month. I mean, every month is great to talk about your heart, but special. So I'm gonna get started. Heart disease is very common in the world, and it's the leading cause of death in the U.S. And the facts are pretty staggering. Actually, one person dies every 34 seconds in the country with heart issues. Yeah, that's pretty significant. And in 2020, about 697,000 people in the U.S. died from cardiovascular issues. So that's 1 in every 5 deaths. And in 2017 and 2018, the heart disease cost the U.S. about $229 billion, taking care of patients in the hospital, and also loss of work and other economic activities cost the country a lot of dollars those years, and obviously every year. And just this is a heat map of the heart disease death rates from 2018 to 2020 from age 35 and plus by county. Tennessee is right here, and it's pretty dark red, which means there's a lot of deaths. As you can see, most of the states around Tennessee, Atlanta, Mississippi, Alabama, Kansas, is very dark red. Compared to some other places in the country. So I don't know. They say it's probably due to socioeconomic factors like diet and all lifestyle factors, but something to keep in mind. So what I'm gonna do is I'm gonna briefly and in general talk about okay. I'm gonna talk about heart problems, common heart problems, and what they can do and how to monitor them, and what we could do in general every day to take care of them. So these are some of the risks for heart disease. There are non-modifiable factors, something we can change, like our age. As people get older, they're at more risk of building plaque in their vessels. That's calcifications and blockages in their vessels, in the heart, in the brain, and in the legs. Gender, it's actually quite interesting. Before menopause, the hormone estrogen prevents women from having a lot of cardiovascular issues. But after menopause, when the estrogen and other hormones wear out, the risks are pretty much similar in men and women, heart disease wise and other vascular disease wise. So interesting. Also family history. Some families have heart disease that run in their families for generations. And the most important thing would be some genes that are shown to be associated with that. So unfortunately, we can't change that, not yet. So maybe in the future. And some modifiable factors such as high blood pressure and high cholesterol, to a certain extent, I mean, they are genetic in nature, but to a certain other extent, we could take care of them. Obviously, physical inactivity, obviously weight, smoking, diabetes, and poor diet. So those are the things we could work on, and I'll try to focus on those things and try to give you some tips and tricks to help you with that. And obviously, if you have any questions in between, please feel free to interrupt me. I don't mind. So, so first thing, I'm going to be talking about high blood pressure, also known as hypertension, and it's also called the silent killer because most people don't have symptoms from it. You could just be walking around and not be feeling anything, and just have an event like a heart attack or a stroke all of a sudden. So that's why they call it a silent killer. And almost half of the American adults have high blood pressure. So, quite significant also. And many aren't aware that they even have it. Some people do get headaches and flushing and nausea and vomiting and like generalized feeling unwell, but most people don't have any symptoms. The best way obviously is to know your numbers and check them at home or at the clinic or at the hospital, wherever you can. And these are the numbers that you should be looking for. Normally your blood pressure should be less than 120 over 80. That's the normal level. Then after that, there's grading as you go up, what kind of high blood pressure it's called. There are stages. There's stage 1, stage 2, hypertensive crisis. I don't know if you heard about that. That's very high blood pressure, more than 180 over 120. That's that probably qualify as an emergency visit if that blood pressure is that high. But after your blood pressure is over 120 and just 120 is fine, and even if it's 80 or more, then you'll be classified as having high blood pressure. Then we'll have to talk about your lifestyle and if you need to be on medications or not. So there are other calculators that we can use if someone has stage 1 hypertension. This is mostly for me, but I would just figured I just want to mention that. But if someone has stage 1 hypertension, meaning these numbers 130 to 139 and 80 to 89, then we'll have to look at our other risk. If you have diabetes, high cholesterol, what's your age, if you have any family history of any other issues, then it's better to be on medications. But if someone is on the younger side, doesn't have those risk factors, then we could try lifestyle like weight, smoking, and exercise to see how you do in a few months. And if that doesn't work, then you probably need medications for that. But so that's when the treatment usually starts, 130s and over 80. Any questions? So these are common myths associated with high blood pressure. So first one, high BP runs in my family. There is nothing I can do to prevent it. Not entirely true. I mean, it has genetic association, but like I mentioned, losing weight, not smoking, exercising, taking care of stress in your life, and just managing your daily routine, just getting enough sleep, things like that can prevent you from getting into these ranges for being on medications for high blood pressure. The next one, I don't use table salt, so I'm in control of my sodium intake and my blood pressure. Table salt is the most important source of sodium. You probably heard about that. That is associated with increased blood pressure, but not the only factor. There are other things, like if you go to the supermarket, get some food, then you want to check the labels for the sodium, which I'll go over in a little bit. Those could be hidden in that, so you might not even know how much sodium you are intaking every day. You try to control, but it just sneak into your diet and your body, and that could cause you to have high blood pressure. The other one is I use kosher or sea salt when I cook instead of regular table salt. They are low sodium alternatives. Not true. Kosher or sea salt actually has the same salt concentration as table salt. so doesn't really make a difference. I feel fine. I don't have to worry about high blood pressure. Going to that fact about high blood pressure being a silent killer, you might not have symptoms. So whenever you go to do a physical every year, or even if you have a blood pressure machine at home, you might want to check once and see what your numbers really are. The other one is people with high blood pressure have nervousness, sweating, difficulty sleeping, and their face becomes flushed. I don't have this symptom, so I'm good. So same fact, repeating the same thing again. You might not have these symptoms most of the time. I read that wine is good for the heart, which means I can drink as much as I want. Interesting. Wine, as you know, is made from grapes, skin of grapes, and those actually have very compounds that are actually good for your heart called resveratrol. So if you consume them in a regular basis, that might help with your heart health. So I mean, it does definitely, and you could just get those compounds from having more fruits in your daily diet. But if you drink wine, like for women they say less than one glass a day, and for men 2 or less. So around 2 is the usual recommendation, but not really saying that you have to drink too much, but once and then it's fine. I have high blood pressure and my doctor checks it for me. This means I don't need to check it at home. So there's different entities of blood pressure. One, you probably heard about white coat hypertension. It's when your blood pressure goes high at the clinic when you're seeing a doctor. Even I get that, so they're quite common. But there's also another entity called masked hypertension, where your blood pressure is good in the clinic, but you have high blood pressure at home, and you might even not know about it. So it's very important to check your blood pressure at home. At least every day or whenever you can, if you don't have a diagnosis of high blood pressure. So the usual method of checking blood pressure at home is to check it at every day at the same time of the day, preferably when you are relaxed and sitting down on a straight chair with your legs on the ground, not dangling by the side of the bed. And you want to use those cuffs. You get those automated blood pressure cuffs in CVS and Walgreens. It's better than the wrist cuff that you use. So just keep that in mind. And obviously before checking your blood pressure, you don't want to be smoking, or you hadn't had any alcohol recently within 30 minutes. It's recommended to check after that. So the next point, I was diagnosed with high blood pressure, but I've been maintaining low readings so I could stop taking my medication. Yeah, people do that sometimes. It's not, obviously not a good thing to do. Obviously the medication is keeping your blood pressure in good numbers. So, obviously keep taking the medications even if you are feeling fine. Okay, so these are some other important things. What raises my blood pressure? If someone had a cold and they took some decongestants, they have some chemicals, phenylephrine is the name, which can increase your blood pressure. So, watch out for that. Salt, obviously we spoke about that. What salt does is, you probably had that symptom when you take a lot of salt by mistake, you feel very thirsty. So the salt causes you to have more fluid retention in the body, and that causes your blood pressure to get high. So ideally they say less than 1500 milligrams per day if you have high blood pressure. Alcohol, obviously, alcohol is a stimulant. It increases certain hormones in the body, and that causes the heart to go faster, and that obviously increases your blood pressure. Hot tubs and saunas, you heard about that, quite interesting. Sorry, you had a question? Oh, okay. So hot tubs and saunas, what hot tubs and saunas do is they dilate the vessels in the arms, and when the vessels in the arm dilate, there's more blood flow, and it kind of simulates exercise. When you're exercising, the blood vessels in the arms and the legs dilate, and there's more blood flow, and that causes kind of a relaxing sensation for people. But what hot tubs and saunas do in certain people is they also increase certain hormones like stress hormones in the body that could increase the blood pressure. Yeah, weight gain obviously. So it's said that if you lose 10 pounds, your blood pressure can go down by 8 to 9 points. So it's very significant, and it's one of the major cause of high blood pressure. So, so 10 points, 8 to 9 pounds. Sorry, 10 pounds, 8 to 9 points. Extended sitting, if you sit for a long time, obviously that can cause weight gain. It's not good for your heart. So I don't think I want to elaborate on that a lot, but you want to be active. Even if you sit down for a lot, try to move around, and even doing small things. Just doing house chores can be good for you. And considering exercise, it's recommended that in a week you do 150. That's 150 minutes of moderate exercise. And if you do extreme or severe or more than moderate, then 75 minutes is a recommended duration. But even if you just go out for a walk, every day, like 30 minutes, has been shown to be good for your blood pressure. Okay, so gonna move on to high cholesterol. So as you know, cholesterol is a waxy substance found in the body. It's actually not inherently bad. I mean, we need cholesterol all the time to produce hormones in the body. Also, it helps with cell manufacture, like the cells that die and that get replaced. Cholesterol is used to replace them. So it's pretty important, but the problem is when you have high cholesterol, high bad cholesterol, that's when you get increased risk of stroke, heart attack, or blockages in the vessels in the legs. So that's when the problem comes in. So cholesterol comes from your liver, like as the video mentioned. It's produced in the liver also, and rest of the cholesterol comes from foods from animals, which I'll go over. What are the bad cholesterol laden food and fruits, or what are the good cholesterol foods that you want to take daily. So like as the video mentioned, there's 3 types of cholesterol: HDL, LDL, and triglycerides. HDL is the good cholesterol that takes away the bad cholesterol. The LDL, which tries to stay in the vessel and causing blockages and decreasing blood flow. So HDL does that. Takes away the LDL from the vessels. And the extra, obviously, LDL is also needed for the functions that we talked about just now. The other cholesterol is the triglycerides. So that's how the body stores the fat in the body in the form of triglycerides. And it is quite common. Actually, what happens is when you take a lot of carbohydrates or drink a lot of alcohol, or if you have any other medical problems like low thyroid, if someone has HIV and is taking medications for that, that causes the triglycerides level to go up, and that's also not good cholesterol. So total cholesterol is the measure of HDL, LDL, and 20% of the triglycerides. So whenever someone comes in the clinic, we look at the total cholesterol. Obviously, the good cholesterol, the more the better. Although it's a little bit controversial, but it's generally considered that the higher the good cholesterol, the HDL, it's good for you. The LDL, the bad cholesterol, we use that number to start treatment. There's certain cutoffs that you use. Usually, if someone's LDL is over 190, and even if it's not 190, but if someone had a stroke or a heart attack, we don't really focus on that number, then you probably need to be on a cholesterol lowering pill, and also the triglycerides level that you use to start treatment. So, as you all know, if there's high cholesterol, yes.
What are the ranges for LDL, HDL, and triglycerides?
Okay, great question. So the question is, what are the ranges for LDL, HDL, and triglycerides? So LDL, anything above 100 is considered abnormal, but there's cutoff for treatment, but cutoff of 100 is the abnormal. For HDL, anything above 40 is considered good, generally in both males and females. And for triglycerides, anything above 150, 150.
Thank you.
Yeah. So if someone has high cholesterol and if it doesn't get treated for a long time, obviously there's chances of having a stroke, a heart attack, diabetes. I mean, it goes hand in hand with high cholesterol. It's like a metabolic issues, and generally when someone's consuming a lot of food at high cholesterol, they're obviously pretty likely consuming a lot of carbohydrates too. Then you probably goes hand in hand. You probably have together those same problems. Artery disease is the one I just mentioned, where you have blockages in your legs causing you to have symptoms while walking, and high blood pressure also similar with diabetes. I think the interesting actually, when you exercise, your good cholesterol goes up. It also lowers your bad cholesterol, but your good cholesterol, the HDL, also goes up. So that's interesting and good to know. So moving on to the next one, some myths about high cholesterol. Cholesterol isn't a concern for children. Just as the video mentioned, there are causes of familial hypercholesterolemia, where you have high cholesterol at a very young age, and unfortunately, there are teenagers who have heart attacks, and we see that sometimes. So it is not common, but it can be seen. And also the cholesterol buildup and the plaque, or the blockages of cholesterol that build up in the artery, those happen over decades. It takes a long time, and even as a children, like at a very young age, you get what you call fatty streaks. There's like just some fat build up in the vessels that start at a very young age, and over decades with lifestyle or with genes, they keep getting worse, and you start to see the bad effects when you are in the 40s or in the 50s, with a stroke or heart attack. So it takes a long time to build those plaques that are significant. Next one, you don't need your cholesterol checked until middle age. Also not true. Adults over 20 should get their cholesterol checked every 4 to 6 years. Thin people don't have high cholesterol. Weight is a big thing, but there's other things also that causes high cholesterol, genes also being one of them. And some people just eat a lot of fast food and maybe don't even gain weight, but still have those high cholesterol in the body. Only men need to worry about cholesterol? Not really. The first thing I mentioned, one of the first thing I mentioned, the hormone before menopause actually helpful to lower the bad cholesterol, and after that, the risks are pretty much similar after menopause, or even could be higher in some women. You should wait for a doctor to mention cholesterol. No, you wanna take control of your health and get proactive. So it's always good to mention cholesterol. Diet and physical activity dictate your cholesterol levels. Important things, but there are other things also, like we spoke about. With medications, no lifestyle changes are needed. Medications are helpful to a certain extent, but if you are not trying to lose weight, if you're eating a lot of fast food, those are pretty much going to negate your beneficial effects of the medications. If the nutrition facts level show no cholesterol, the food is heart healthy. I'm going to go over some nutrition labels. I think that's going to be very important, so I'm going to explain that in a next slide. Using margarine instead of butter will help lower cholesterol. So margarine actually, not solid margarine, but liquid margarine has a lot of good fat, and if you could substitute that for butter, actually good for you. So something to keep in mind. Yeah, liquid margarine, not solid, just liquid. Yeah. So these are some of the ways to get rid of the bad fat. Focus on fruits, vegetables, whole grains, low-fat dairy products, poultry, fish and nuts. Limit red meat, fried foods, and sugar-sweetened foods and beverages. Offer naturally occurring oils such as canola, safflower, sunflower, or olive oil. Not coconut oil, that's considered bad. Those are the tropical oils. So you want to consume this canola, safflower, sunflower, or olive oil. Use soft margarine as a substitute for butter, and choose soft margarines over harder stick forms, so not solid margarines. Donuts, cookies, crackers, muffins, pies, and cakes are high in trans fat, so those are bad fats. Don't eat them often. I mean, sometimes you can't. Yeah, I'm going to go over some food labels, which I think will be very important. So this one is from a margarine label, food label, and this is label is from nuts. It's a bag of nuts. So just gonna, I don't know how much you actually know, but I'm just gonna go over some basic stuff. So every label has the serving size, and sometimes it could be confusing, but this serving size is 28 grams, and this serving size is 14 grams. Some labels have serving size as the amount, like four loaves of bread, or four pieces of something. So you want to keep track of that. So that serving, it will say how much calories that's 190 calories in one serving size, and then it will give you the percentage of the daily value, like that you are supposed to be consuming on a daily basis. So those are listed here. So total fat, this label has, so just the breakdown. So there's saturated fat, trans fat, polysaturated, and monosaturated fat. It's kind of confusing, but poly and monosaturated fat are the good fat. So it has 13 grams and 2.5 grams. These are, I think almonds. They were almonds. Yeah. So almonds have like a lot of good fats. The poly and the monosaturated fat. So you wanna, whenever you look at a food label, you wanna make sure it has a lot of those fat, the poly and the monosaturated fat. You want less of the trans fat. Trans fat is basically butter, or those very other fatty stuff like what you have in red meat. Those things, you want that to be as near to zero as possible. And also the saturated fat, it's not that much, 1.5 grams. But when you go over here, this is the margarine, also has a lot of poly and monosaturated fat, but a little bit more of saturated fat, and no trans fat. So you always want to make sure the poly and the mono fat is high, but the saturated and the trans fat is low or near to zero. And the cholesterol is like a general, what they mention, including all the other compounds. Sodium, how much, that's a salt, Total carbohydrates. So when you look at the carbohydrate label, you want to make sure it's higher in dietary fiber and less in total sugars. Obviously, it has less, added sugar, the better. That's the extra sugar that you have in certain beverages. So you want to make sure that's zero and more dietary fibers. proteins, obviously, it's 4 grams, a lot of proteins in almonds, and these are some vitamin numbers that they give. So yeah, most important thing, I'm assuming most of you know about sodium and carbohydrates and fibers, but most people don't know about this poly and monosaturated fat. So that's quite important. So just wanted to repeat that again, the poly and the mono instead of the saturated and trans fat. Yeah, so actually, so this chart I actually got from, it's one of the European study that they did, and they recommended diets, what to avoid, and what to take in moderation, and what to be preferred. I just labeled them as green, yellow, and red just to make it easy. But so red, you want to consume that in limited amounts, like pastries, muffins, pies, croissants, vegetables in butter and cream, cakes, sausages, just to name a few. Coconut also, frying, trans fat and hard margarine, better to avoid them. Palm and coconut oils, butter, lard, and bacon, as much as you can. I mean, very limited. So to be preferred, like whole greens, raw and cooked vegetables, lentils, obviously, some fresh fruits and vinegar, grilling, baking sometimes, and skim milk and yogurt. And these are a few things in moderation, such as potatoes, a lot of carbs there, honey sometimes, low-fat milk, skim milk, and this is low-fat milk, just regular milk here. Olive oil, this is in moderation, but olive oil is very good. I would say it's to be preferred, but stir frying and roasting sometimes. But you basically want to avoid this as much as you can. Okay, so I'm gonna be talking about diabetes now. Diabetes, as you know, is a condition that affects how your body uses food and sugars. Basically, there's a ton of sugar in your blood vessels, but it's not being utilized by the body because of insulin resistance or lack of insulin. So levels that we use to diagnose diabetes, is fasting when it's more than 126. That's right after you wake up in the morning, and A1C of 6.5. And these are levels for pre-diabetes also, who are at increased risk of going back to diabetes or going into diabetes. So what are the symptoms? Extreme thirst, losing weight, numbness in the hands or feet, slow healing cuts, blurry vision, feeling hungry even while eating, and frequent urination are quite common symptoms that you see. Also, if you have diabetes, you could have effects in your nervous system, eyes, teeth, gums, pretty much same as the other things that we talked about before. Why is it dangerous? Obviously can lead to a stroke, heart disease, or heart failure, and it can threaten vision over a long time, and limbs and extremities if you have neuropathy, and if you get wounds that don't heal properly, and unfortunately many people get amputation also. So next one, so who should be tested? Recommended to test everyone above 45 at least once, or every 4 to 5 years after that if it's normal. If someone is younger than 45 and overweight and have other risk factors such as high blood pressure, high cholesterol, there's a family history of diabetes. There are certain ethnic groups that have high prevalence of diabetes, such as African Americans, Asian Americans, Hispanics, Native American, or Pacific Islander descent. And also, if there's a history of gestational diabetes or delivering a baby more than 9 pounds, that's also a risk for developing diabetes in the future. So, diabetes, you could do these small steps to control your blood sugar, such as planning your meals weekly, limiting red meat, enjoying frozen vegetables and fruits. You just want to make sure, like when you get frozen stuff from the supermarket, they don't have any extra added sugars or extra added salt. So you just want to make sure. But frozen vegetables and fruits are similar to just regular fruits and vegetables. Reduce eating out, obviously. Eat before you go shopping. Grow a garden. You want to get that organic, healthy, with less pesticides and good stuff from your garden. Shop for seasonal produce. Will be cheaper, obviously, and more healthier than getting someone that's frozen or not seasonal. Look for generic brands, which will also be cheaper for you, and make your own snacks. Whenever you have to go somewhere, then trying to snack out. It's going to McDonald's when you're driving somewhere, or things like that you could avoid if you make your own snacks going on a road trip. Okay, so moving on to the last topic, I thought this was important to mention, like what is a heart attack, what are the symptoms, so I thought, this is important, so, sorry. So, you probably know there are three main vessels in the heart. There are two vessels in the left side and one on the right side that supply blood to the muscles of the heart. And this is the aorta over here. So what happens is, over time, this is a vessel. Over time, there's fatty deposits that keep on building. Over decades, they get worse, and there's a tear in the fat deposits. And when there's an acute tear, the body tries to heal that with thrombosis, meaning just try to form a blood clot to control that leak in the cholesterol or the fat deposits. And when there's that process, then it totally blocks your vessels, and that causes no blood flow distally, meaning away from the blockage, and that causes the muscle in the heart to slowly die and causes you to have symptoms. So that's basically what happens. We think every heart attack presents with similar symptoms like chest pain, getting pain in your neck, or pain in your left arm. Actually not true. Most people, have very different symptoms. They could just get pain like in the mid chest or in the back. Some people could have nausea or vomiting. Some people could just pass out. So it could present with very different symptoms. You could get dizzy, so things like that. You could even have pain on the right side, so not quite common, but you could have that. And especially in women, they saw that you don't get typical symptoms. It's very atypical symptoms in women. That's basically not getting those substernal, like pain radiating to the left arm. Those typical symptoms, usually even if it's seen in mostly men and not women. So, something to be conscious about, I think. So, wanted to wrap up everything we talked about. So Olivia actually came up with this Life's Essential 8. For a cholesterol or just like living healthy, you want to eat better, manage your weight, be more active, quit tobacco, get enough sleep, 8 to 9 hours, on average, control your cholesterol, manage blood sugar, and manage your blood pressure. So with that, I'm gonna end, and if you have any questions, any more questions? Yeah, no, thank you. Thank you.